Advance IV was a randomized, double-blind, phase 3 clinical trial that was conducted around the world on patients who had either chronic or persistent immune thrombocytopenia. All of the patients were adults, and they all had a platelet count of less than 30,000 at the time of entry into the study. Each patient had failed at least one prior therapy and was either on a therapy that was not working or had failed an additional therapeutic intervention. The patients were randomized 2-to-1 to receive either Efgartigimod, which is a neonatal receptor agonist, versus placebo. And what we were looking at in this analysis of the trial was not efficacy, which we reported on last year, and a paper was in Lancet not that long ago, but we were looking at how long did it take the patients to respond. One of the things that's important for ITP patients is the quicker we can see an improvement in their platelet count, the less likely they are to experience a significant bleeding complication. And what we noted in this trial was that the Efgartigimod patients had an increase in their platelet count to above 30,000 by week 1, so by 7 days, which was the first time point measured. And then when we looked at all measurements of response at 6 weeks, patients in the Efgartigimod treated arm had a significantly improved response rate over placebo. So whether we looked at platelet count over 30, platelet count over 50, platelet count over 100, 2 platelet counts over 100, or IWG criteria, which includes not only platelet counts, but bleeding events. The patients who had received Efgartigimod, when we looked at 6 weeks, significantly higher numbers of those patients had achieved responses in all of those categories. So I think the bottom line from this trial is that Efgartigimod does, in fact, improve platelet counts, and it does so relatively rapidly. We start to see that clinically meaningful improvement around 1 week after the first dose of medication. And when we look at 6 weeks into the therapeutic intervention, those patients continue to have an increased improvement compared to patients who are on placebo.